Our next group of speakers deals with an epidemic in our industry with regard to mental health. And the iron workers and their contractors through Impact decided to insinuate ourselves into an organization called the Construction Industry Institute. It's based at the University of Texas at Austin. It's dominated by our very able and capable competition, and we thought it was a good use of our resources to go and tell our story to a bunch of people that don't use us. And I was super proud and super excited when at their annual conference in San Antonio last year, our own Bert Royer, Impact Regional Director, 19 years business manager of the Regina Local, was on stage at their event talking about his role as a vice chair of a research committee dealing with mental health, Research Team 401. So I'm going to turn it over to Bert, and he's going to introduce his panel. Pay close attention. This is something that we really need to address immediately. Bert?
Morning. Let's talk about mental health. For the past several years, and certainly since the pandemic, mental health has moved to the top of the pile. The conversations about mental health are becoming more and more important. This research project the idea started about 3 years ago at the CSRA, Construction Safety Research Alliance, University of Colorado Boulder. And the discussion took place, and they ended up partnering with CII to complete this project, the Construction Industry Institute. And Research Project 401 was born. Committee was put together, and I have a little side note. The report is available on the app. If you go to this session on the app, it's been downloaded. Just so everybody knows. I want to tell you how the data was collected for this. It was done by email. So we sent emails across North America. We sent emails to men, women, all ethnic groups involved in the construction industry, and we also included office staff, which made a big difference. We had 1,197 respondents to the survey, and it was a fairly lengthy survey, so that was a good response. And I'd like to start by introducing my panel. I got them in the wrong order here. So beside me I have Ted. Todd Dennison. Where's my phone? Sorry.
I'll go by Ted.
Huh?
I'll go by Ted.
Okay. Todd. We have Todd Dennison, HSC Manager, Matrix Project Services. Dr. Sid Bandahari, Associate Director, Research, CRA. Dr. Fred Sherratt, Director of Research, CRA. And Mr. Mike Court, Senior Vice President with Graham Construction, and he's also the Chair of the Board with the CSRA. Question number one. Mike, why is there such a push to address mental health problems among construction workers right now? What is driving this interest?
I'm first, am I? Okay. First and foremost, it's about the people. From our perspective, where I work, we could see the trends. You've all heard the trends, you've heard the news, you've heard the data. And we had to do something different. And from the CSRA perspective, this was a board initiative. The board focuses on, the CSRA focuses on prevention of SIF in the construction industry as our primary focus. And mental health is directly tied to that. So it's an important research topic. It started to Bert's notes a couple years ago. Phase 1 has been completed. And fundamentally, the industry needs to make a change. We all need to make a change. We need to create an environment where it's safe to reach out, get help, get rid of the stigma and the taboo tied to mental health. Create an environment where we understand those that are living with mental health concerns. Quite frankly, it's great for the industry, it's right for your businesses, and most importantly, it's right for our people.
And I'll go to Sid. What did you learn from your research so far, And what should we look forward to from the CSRA on the mental health research front?
Thank you, Bert. I'll make 2 points for everybody today. And for each of those, I'll talk to you about the practical takeaway that you need to walk away with. First one we did was, when we started this project, was try and understand what the medical science is telling us about mental health, and how can we translate that evidence into something folks can understand within our industry. I'm glad Bert just addressed me as Sid, and Fred will back me up on this, is that we're fake doctors here when it comes to mental health. This is a serious point, though, which leads to my first point, is you must interrogate people bringing up solutions, because right now within the industry we have a lot of snake oil silver bullet solutions. It'd be great for Fred and I to walk up here and be like, here are the 10 signs to see somebody with depression. Absolute nonsense. There is no generalizable evidence that exists right now that there is one solution for us to implement in occupational spaces for people. People don't respond well. When it comes to health, we can't just throw the kitchen sink at this, because it's not positive outcome, or at best nothing happens. It's positive outcome, nothing happens, or something negative happens, because health doesn't work that way. Pair somebody with the wrong solution and you can have a problem. The second thing, which relates to what Bert was talking about, the data that we collected, we asked people from across different sectors, and 1,100 people responded, 1,200 people responded to this survey, about 600 from the office and about 600 from the field. When was the last time we got 600 people from the field to respond to the survey? Was very surprising for us. But here's what we found. Caucasians, Hispanic, office people, field people, young people, older people in the sample that we got, all said the same thing, which is they have top 3 stressors. Number 1, financial uncertainty. Let me be very clear, financial uncertainty just doesn't mean poor compensation. It means they're uncertain about where their next paycheck is, or whatever their financial status is. Number 1. Number 2, job demand. We know, we talked about labor shortage in the morning. We know how work tends to translate. When folks say that there is toxic masculinity on job sites, I tend to chuckle to myself, because, well, we are asking them to be that way, be the man's man, if you will, and go those extra 10 steps and do the work. So that was number 2. And number 3 was factors outside work. The only point I want to make here as I wrap up is, again, remember, all the groups said the same thing. Their ranks were exactly the same. Factors outside work ranked number 3. The first 2 were industry-specific stressors, things that you all can directly impact. Factors outside work, it's not within our purview, it's not within our gift to give. So that's where we should be cautious and be very, very careful what kind of resources we are providing. And the last thing I'll say about the data, and this guide will be a good resource for you, is it tells you where to start and what not to do, as well as what to do. And so that's very important for you all as leaders in the room. You need to be very carefully asking yourselves, what is it that we can't do, and what is it that we can do? And as you remember these results, just remember, all the different groups of our sample said the same 3 stressors were their most highly ranked in the same order.
Thank you. Fred, what should we be careful about? Is there something that we as the industry should avoid?
So to follow on from what Sid said, we've got our 3 stressors. One of those is not something we can control, but the other 2 are really quite root causes. And those are elements, as Sid said, we can do something about. So the mental health problem that we're seeing in the industry is actually a symptom. It's a symptom of these causes. It's not something that we want to put a sticking plaster on. It's not going to do the job. And the thing that starts to get worrisome is, as Sid mentioned, when we get people telling us they have a solution. They have a 5-point plan, implement this, you'll be fine. But the problems come. I think back to when I used to be a superintendent in the UK. I've run very big job sites. I've worked with a lot of iron workers. But back in the day, if somebody got hurt, say an injury, minor, whatever, I didn't send them to Steve in the stores to fix it. I didn't say, you've broken your leg, I can fix that. And that's where I think the danger lies, in that we all want to do something. This is such an emotive, personal, human subject. But what we actually need to be looking at and thinking about is, am I the right person to do this? We wouldn't send somebody to go get their broken leg fixed in the store, so we shouldn't be sending perhaps somebody, go talk to your colleagues, they'll be able to support you. That leads to dangerous solutions. I wouldn't take my advice on anything really in that regard. So all we can do is be really good signposts. That's what we need to be able to do. This is a proper medical situation. We can't magically come in with some training or some peer support system or some other solution that's just going to magically make everything all right. We know that the causes are something much deeper. These are just solutions we're seeing. But we need to treat them in the same way that we would anything wrong with someone's arm, leg. Your brain works the same. It's that important. And we really need to be careful that we're not, as Sid said, falling into traps. In the guide, there's some really good pointers. There's a flow chart for you to follow when somebody comes with a solution. And you can look, is that based in peer-reviewed research? Is there empirical evidence behind this? Follow the science, and you'll find it's much more different than perhaps we're being told at the minute. So I think that's our biggest vulnerability. We all really want to do something. I want to do something, but we shouldn't do anything. That's the big difference. Thanks, Bert.
Thank you. Todd and Sid, what gives you optimism and pessimism about how the construction industry is tackling mental health?
Okay, good morning, everybody. I would say from the optimistic standpoint, I look at organizations like CII and CSRA taking the time and the resources to study and dedicate tremendous amount of resources to this. Having industry contractors, the clients, owners, and collaborating with the academic side and doing real research on this. To me, that's really optimistic. It's a very powerful tool when you blend all this knowledge together on these projects. I would also look at, when you talk about pessimistic, I put it cautiously optimistic, but I think both Fred and Sid touched on it, is the side of the industry. There's a lot of noise around, mental health solutions. You can Google it online and you can find 100 different people offering solutions to medical problems that aren't medical doctors, and quite frankly, are likely not qualified to give you what you need to help your folks. We, as an industry, and the people in this room, and whether it's HSC professionals, project managers, whatever you're working with, we need to really be that bridge to get people the qualified help they need when they need it. The other piece on talking about optimistic or a little pessimism is this problem isn't going to go away with a one-size-fits-all solution. It's not going to go away by having, your one department in your company, go take care of this problem. It has to be a collaborative effort across all the groups in your companies and within the industry. And sometimes we're going to have to change how we do things. What that change is, I can't exactly say for every company, but it takes resources, time, energy, and sometimes it's going to take having to do things that are different than how we've always done them, as we've talked about earlier today. So, but much more optimistic than I am pessimistic about what we're doing and how we're going about it, and all the groups. One more thing on what you said about the research. That's probably one of the things that made me surprised me the most, but was most optimistic, was after going across all the different demographics we looked at and surveyed, we're all in the same boat. We all have the same concerns about the stressors. So I'm optimistic that we can focus on what we've learned in this first study to come up with solutions that will help everyone in this room, the people you work with, work around, come up with ways for mental wellness for your employees, which is going to make it better for our industry.
Thank you.
I'm much less optimistic than Todd is right now. And I'll give you my reasons for it. And I will end with the optimistic note. First, I'll tell you why I'm pessimistic. I'm pessimistic because as our first speaker in the morning was mentioning on one of the slides, that our organization doesn't do it that way. We do it differently. That's usually the response we hear when we poke holes in certain solutions. And therein is the problem. There is a lot of dissonance in people in trying to justify what they're doing because there's sunk cost. And we understand that. It is a difficult issue, and it's hard to say that what we are doing is not working. So that requires introspection. The other thing I'll mention also is that technology is becoming a huge impact into mental health. We are getting apps. We're getting these online resources that are trying to help people. Somehow we've trusted the computer scientists to come to help us with mental health. I don't know how that jump happened where the nerds, the worst of the nerds, came to help with mental health. That is just backwards. Because if, the jokes aside, if you go to these apps and you go to the background that they have, very rarely on their team do they have a psychiatrist. They're all computer app developers with machine learning programs where the machine is supposed to learn from its mistakes. However, you're learning from mistakes, meaning you're telling somebody bad advice. How many people here, by show of hands please, believe that construction workers have a stigma around mental health? There is a stigma that exists in talking about mental health. I want you to take a look around. Keep your hands up, please. That's about 100% of the room. And somehow we are trusting them to help each other by giving them a training on how to be empathetic with each other. When was the last time 1 or 2 training sessions solved these problems? I mean, safety will give you the best example. We've thrown training at everything in safety. It doesn't change behavior that easily. So when we wonder why bad coping strategies are so pervasive, it's because we are going towards that direction. And a final thing I'll mention in the pessimistic side, which is not pessimistic, it is just a call to action for you all today, is that let's not be finding the cure, let's be preventative. Right now what we are trying to do is we are trying to go and fix people's suicide ideation. Let me be very, very clear. The poker chips and other things are very helpful. Let's give people the resources that allows them and guides them, like Fred said, signposting them towards the right direction. But if you're addressing substance abuse or any of these things, that is, the train's already left the platform. So if you want to be addressing mental health, you have to be in the preventative game, which means changing the way we do work, what we expect from people. And therein is the optimism, because the fix is not actually having to get a bunch of doctors in the room and trying to fix mental health. They're doing that in their own community. We need to change the industry. That's within your gift to give. That's within something you can actually bring about. And this forum, by having us on the stage, I want to thank Impact for that, is how we begin that conversation of, okay, we've started the conversation, we want to make right investments. How do we shift our focus? Because down the road, it's going to be trying to turn around a very, very big ship, and then eventually it's going to be trying to turn around a Titanic. Right now, we have the opportunity to turn around before we've gone too far into creating another pyramid or another solution that 10 years down the road we're going to make fun of. But this time it will be to do with health and not organizational arrangement. So optimism is, this is solvable.
Thank you, Sid.
We've got a little time if you wanted to add anything.
I would echo 90% of what you said.
I want to hear the 10.
We have to build resiliency with our people to manage mental health. So mental health training and education, I think, is important.
Yeah.
And building those resiliencies for our people and our people's family. It's not just our people, it has to go to the home as well, as we saw from our research. So, and Mark's message this morning was spot on. We've been through this game before with safety. What can we do differently to speed it up and not fall in the same pitfalls like the pyramid that we did in safety with mental health?
Yep.
And so let's take the learnings from safety and put that to the mental health. Be cautious of what we're doing. We think we're doing the right things at my company. I'm not sure if I'm helping or hindering, and that's why this research is important.
Cool. The final question, if you wanted to leave the audience with some parting thoughts, what would they be? We'll start with Todd and work down the line.
A couple things. The guide to mental health that was done in the first research team here past year that's published and it's on the app. Encourage everyone to read it. Really take the time to read it. It's really well put together. It's easy to understand, but I think if you read through it, like we did in our company, what we realized is a lot of the things that we were thinking about doing and a lot of the things that we'd like to do, all well-intentioned and well-meaning, when you read through that guide, it'll give you some pause to really think about what and how we're doing things. Everyone wants to do something, and that's the good part. Everyone wants to help, and I think everyone is aligned that there is an issue, which not too often we get alignment across the board, an agreement that we have to do something, but we just don't want to do something for the sake of doing it and possibly making things worse for some folks. So, please take the time to read that. It's very informative, and I can tell you for myself, being lucky enough to serve on this panel and hearing all these perspectives from all over the country, all over North America, from different sources, it was an eye-opener for me. So take the time, look at that, look at what your company's doing, and see what you can take away from that.
Wonderful. We have an ongoing research project within the CSRA that we are continuing to push forward. We're trying to deepen our understanding on how these work-related stressors manifest into different aspects of the job for different sectors of people. We're going to be conducting focus groups. So if you are contractors, owners who are interested, the CSRA's work is nonprofit, so it's published open source on our website that you can access at any given time. We also have 1 hour length presentations that are posted on this topic where we've disseminated our findings in much more detail. The second thing we are also doing that I'm very excited about is we are working on creating a new tool for you to measure the effectiveness of what you already do. Currently, the kind of tools that exist measure people's health and ask them to report on their health. Doesn't tell you whether your intervention is working or not, because a number of things can be impacting their health. How is your intervention for mental health working? To Mike's point, is your training effective? Are people actually liking it, or is it a waste of time and resources and they would wish the management focused somewhere else? We're trying to create and validate through science that kind of a tool. And again, when it's ready and tested, it'll be posted on our website. Anybody can download and use it. You don't have to be a CSRA member or any of such thing. So I encourage you to keep an eye on our website and just use these resources, please, and check out those presentations. But I want to thank Bert for this opportunity.
Thanks, Sid.
I think that's an important thing to reiterate is the CSRA work is science-based,
Yes.
peer-reviewed, and defendable, whether it's mental health or safety. So it's new. It's something that we haven't really seen in industry before.
And yeah, you're quite right, Matt. That is what sets us apart. We don't make a ton of money off this consulting. We are entirely funded, and the research that we do is funded by industry, and we share all our results openly. So you can find a whole bunch of stuff on our website. I will do a shameless plug right now. Thank you for the setup. Do check out the CSRA or come and talk to Sid and I later on if you want to know more. I think this morning's been really interesting because some of the things our keynote was saying this morning about this might be our pivot point generationally. I think the younger people coming into the industry see mental health. They have grown up in a whole other world. Say what you like about smartphones, and I know Sid and I like to argue about this, but this is a global problem. This isn't a construction problem. It's not an iron workers problem. It's an everyone problem. And attitudes are changing. towards it, considerably in those younger generations. I think the best thing we can do is listen to and enable the voices of the people coming in to be heard, because that's where we're going anyway. That is the future. So we really need to think about what are the causes that are creating these symptoms that we are able to do something meaningful about. And by meaningful, I mean we're not just launching another initiative, not giving everyone another sticker and a thermal cup and saying, here you go, that's going to fix you. Because we're not the people able to do the fixing at all anyway, which as construction folks, I know really annoys us, because there's nothing we can't do. I know that damn well. But this is something that's out of our skill set. This is not something we are able to play with, and we shouldn't be messing. So I'm hoping some of you are a little surprised at what we're saying on this stage today. I bet some of you thought we might be sort of talking about something in a slightly different way, pitching what we've developed. But we went with the science, we looked at the actual medical research, we looked at what's been published from those fields that are very different to our own. And we realized this is maybe somewhere we shouldn't be messing with beyond being awesome signposts, being really helpful, things like the chips, directing people to people who are skilled, trained, and qualified to do something about this. And whilst, I mean, I can build anything you need me to build, but I can't fix a person in their mental health crisis. That's out of my skill set, and I knowing and admitting that to ourselves is probably a really big thing we can just take away from today. Thanks, Bert.
Thank you.
Mike.
I agree with everything you said.
Oh, thanks, dude.
Mike also happens to be the chair of the CSRA, so he's pushed for this project,
Yes.
and we appreciate. And I want to take a second here to thank Bert as well. He was the vice chair of our first phase of the project. As you can see on the screen, Bert was one of the leaders of this team. So Impact played a huge role in making this happen, and I hope they will continue to play a big role in the phase 2 of this research as well, which we hope to share with you soon. But Bert, I want to even open it up to you. If
Yeah,
you
I have a
can.
couple of comments to make. First off, I'd like to thank the panel. The one takeaway that I have from working on this research project, we're not going to fix, there's no magic wand to fix a group. It's one person at a time. If somebody comes to you and wants to talk, do not tell them your story. Listen to their story. They trusted you enough to come to you. Work with them. Steer them in the right direction. We're not medical professionals. We can't fix the world, but we can assist them to find the help that they need. And I think that's an important issue. Too many people just kind of push it off. If somebody comes and they want to talk and they're serious about it, they're having issues, take the time to listen. Be kind to each other, and where you can, take the time and steer them in the right direction.
Can I add one little thing to that? Please don't forget the mental health of the HSE person you've tapped on the shoulder to go solve the mental health, because they're receiving the 2 a.m. calls now. They may not know what they've signed up for. So just wanted to add, being kind to not just the frontline people, but the management people that you've asked to go sort out mental health as well.
And again, as mentioned, the stressors were identified in the first research project, and there's a continuation. I'd like to thank again the CSRA for the work they do. They really care, and they put together good committees, and I'm glad they picked this project a couple of years ago and made it happen. There's a lot of people talking about mental health, but there's very few doing a lot about it. I believe the CSRA is, they're on top of it, they're ahead of the game, and I think everybody will benefit from the research they do. That's our pitch. Thank you very much.
Thank you.